Welcome to Savitha Dental College Lecturecast, Oral and Maxillofacial Surgery, Cyst of Maxillofacial Region. Grimmer defines cyst as a pathological cavity having fluid or semi-fluid or gaseous content and which is not created by accumulation of pus, but mostly lined by epithelium but not always. We classify cyst according to Shear's classification. So it's categorized into three. One is cyst of jaw and cyst associated with maxillary antrum and cyst in soft tissue of face and neck region. So cyst of jaw further classified into epithelial and non-epithelial. And epithelial components are subdivided into odontogenic and non-odontogenic, and odontogenic is further classified into developmental and inflammatory. In developmental we have primordial cyst, dentigerous cyst, periodontal cyst and gingival cyst, and in inflammatory we have radicular and paradental cyst. Non-odontogenic, we have nasopalatine, median palatine, and globulomaxillary cyst. And non-epithelial cysts like traumatic bone cyst, hemorrhagic bone cyst, and aneurysm bone cyst. And cyst of maxillary antrum like post-operative maxillary cyst, retention cysts like mucosal can occur. And cyst of soft tissue in mouth and neck regions are like thyroglossal cyst, brachial cyst, and dermoid cyst. Cyst formation, that is pathogenesis. This formation occurs because of remnant of epithelium from odontogenic or non-odontogenic. It occurs in three phases. First is phase of initiation. In this, the infected necrotic pulp contains a lot of microorganisms like actinobacillus, 4-5 and streptococcus. So this releases endotoxins, and this endotoxin triggers the inflammatory reaction. As there's a secretion of cytokines, interleukin 1 alpha, beta, interleukin 6, and this triggers a peripheral tissue to proliferate. And second, which start of phase of cyst formation. In this, the mass apical granuloma is produced. So as increase in size, the central part is cut off from the blood supply and goes for autolysis. And in mean, there's a secretion of matrix metalloproteinase collagenase enzymes which dissolve the matrix substance and forms like a ovoid called as microcyst. And this microcyst combines to form a bigger cyst, which leads to a third phase as a phase of enlargement. The two processes combine in phase of enlargement. First, there's a lytic products, there's increase in osmotic pressures and reduce hydrostatic pressure. So this imbibition of water and enlargement of the cystic cavity. Simultaneously, the receptor activated N-CABA ligand, prostaglandins, prostacyclins, and osteoclastic activating factors produces gelatinase, interstitial collagenase, and collagenase like metalloproteinase, and this leads to bone resorption. Here we see about histopathological slide. The first picture shows of apical granuloma. Second slide shows of transition from apical granuloma to a dissolution of matrix substance. And third is the formation of a microcyst, mosmocyst. And fourth, it combines an enlargement of the cyst. How to diagnose a cyst? A small cyst are routinely found in a radiograph when there's of non-vital or root stems there. A bigger cyst shows bone expansion, so we can isolate ping pong ball effect, eggshell crackling effect, and flexion test of positive. Site of more specific, the radicular periodontal dentition cyst occurs all over, a visual cyst in the maxilla, and solitary cyst more specific to mandible. And OKC, even a dentition cyst are more common in third molar region, lower third molar region. Absence of teeth, we suspect of dentition cyst or OKC. When there's paresthesia, anesthesia, we have suspect of infected cyst. And vitality, we have OKC, lateral periodontal cyst, fistral eruption cyst, or we can find vital teeth. And radicular cyst is a non-vital tooth be there. Percussion will show dull and hollow sound. Patients are symptomless. They may be having missing or discolored tooth. Pain and swelling occurs only when there's an infected cyst. And patient may complain of nasty taste and smell. Radiologically, there will be a radiolucent lesion with circumscribed radio-opaque margin. Any monolocular lesion has to be differentiated from a benign neoplasm, and any multilocular cyst should be differentiated from the giant cell or hemangioma. The next step in diagnosis of cyst is aspiration. Use a whiteboard needle, put it into the lesion, and then aspirate. A stockler fluid is seen in radicular cyst, dentigerous cyst, and dirty creamy white in the odontogenic keratocyst, and this will be negative aspiration solitary or traumatic bone cyst, and there's a blood tinge aspiration seen in a aneurysm bone cyst. The diagnosis are confirmed by your biopsy. Thank you.